Hello and welcome to Dr. Randy and Paws, Reflect and Heal. This is a great day because we're going to be speaking to definitely one of my favorite people and someone who's going to very much enlighten us about our microbiome, our animals' health and wellness, and how we can really make a huge change. I want to let you know that Paws, Reflect and Heal is being brought to you by Paws Veterinary Center here in Tucson. We are an integrative veterinary practice that reflects on a transformative type of medicine where we offer all of the great Western therapies along with a lot of holistic or complementary therapies. And also want to remind our listeners that any questions you may have for myself or Brandon can go right to our website, which is randy@drrandyaronson.com. So please feel free to send them along. We'll answer them post podcast and get back to you. And hopefully this is just going to be one of many that I'm going to do with Brandon. So let me introduce Brandon Burch to you. Brandon is director of AnimalBiome Veterinary and a very knowledgeable individual in health and wellness for our pets. This is a technology that I have told our listeners before I brought to my practice a number of years ago. And it has been the greatest boom to our practice as far as the quality of wellness and health that I can achieve. We're going to talk about different conditions that it's useful in. We're going to talk about that it's useful in basically getting our animals started in life. And this is kind of what Brandon and I have been working towards, that we're going to start our puppies with wellness with this type of technology. But first, I'm going to ask Brandon to just give you a little background about himself, and then we'll talk a little bit about biome. Brandon, it's yours, buddy.
Yeah, absolutely. Thanks so much, Dr. Aronson. Appreciate you.
Sure.
So started with regards to AnimalBiome Veterinary about 3 years ago now. And, before that, my educational foundation was really kind of brought up within regards to veterinary medicine. So I went to school, got my bachelor's in science for biomedical science, biological sciences, got into virology, and then jumped over to Western University for a couple of years. My entrepreneurial spirit, however, made me decide to choose a different course and really decided to jump into the diagnostic and entrepreneurial space within veterinary medicine. With that being said, I mean, my dad was born in 1939, and he's a veterinarian. I just got him to retire about 3 years ago, so he's been practicing for about 60 years. So,
right.
I started pretty much at the practice, lowest rung of the ladder, cleaning dog cages, all the way to being able to put in IVs and assisting in surgery. So, my life has been kind of around veterinary medicine. And so understanding the ins and outs is really important. And really excited to kind of go over microbiome medicine and I think one of the things that we really kind of can delve into is understanding these refractory cases and what we're seeing. And I'm sure you see the same thing at the practice. And, antimicrobial resistance, pathogenic resistance, this is important things, these stewardships that you're really putting in there at Paws. And so really excited to be on board and go through this stuff with you.
Great. Could you tell our listeners a little bit about the company itself, how it got started and who's involved? That would be really helpful, I think, for background.
Yeah, absolutely. So AnimalBiome as a whole, we've been around since about 2013. It started with Dr. Holly Gans, who has a PhD in microbiology. And it started with her own dog, Yuki. And Yuki, let me see if I can pull up these slides real quick, and I'll just kind of briefly share this with you guys. I think it'll kind of enlighten kind of what's going on. But Yuki here came in with HGE, hemorrhagic gastroenteritis, and went to the veterinary office, and they're like, yeah, it's something, we have an infection going on in there, some sort of bad bugs, not sure what it is. GI panel came up, not really unnoticeable, unremarkable. And so then started to figure out, well, that's not good enough. I want to know more. And really kind of jumped into trying to understand the microbiome. Now, she had previous experience with microbiomes, and she worked in regards to HIV study and things of that nature on the human side. And so she really kind of pulled that forward and created a Kickstarter back in 2015, where she was really trying to find out microbiomes in regards to cats and dogs and doing testing on that on a molecular level. and raise enough funds and really started to create that first test that came out. And that's at the point where great, they have a test, they're able to kind of see these different bacteria and microbes, but what do we do about it? If it's just utilizing our standard, broad spectrum antibiotics, how does that help us? And so the real answer to that was being able to utilize native microbes. And I think Dr. Aronson will get into that in a little bit, but 2017 was when we first launched our FMT kind of capsules to be able to treat and utilize microbiome medicine for these sorts of chronic refractory cases. We really started to expand that microbiome medicine line. And, AnimalBiome Veterinary, we've been around for about 3 years. We started, I think Dr. Aronson was one of our first clients. We started about 22 veterinarians. We probably have about 2,500 in total now that are utilizing our products
Wow,
around the U.S. So
that's great. That's great
it's been
news.
an incredible kind of journey, and it's not stopping anytime soon. It's really great to kind of see how that works. But that's kind of us in a nutshell. We're trying to improve patient health by not just depleting all the bacteria in the gut, but really coming to understand what's the causation, what's the real reason for these patients and this chronic kind of symptoms, and how do we kind of overcome that and be able to look on it in a case by case scenario.
Perfect. Perfect. So let's go back and talk a little bit about what microbiome is. I'm still amazed because I'm watching TV now and seeing commercials for humans on vitamins that basically say, "Oh, this really helps your biome," and yet I would say honestly, about 50% of my clients that I see, and I'm getting a fairly selective group, still don't know what microbiome is. So talk a little bit to that if you could, Brandon. That would be really helpful.
Yeah, absolutely. So, in essence, a microbiome is like a diverse collection of microscopic organisms, and they typically reside within a living space. So, today we're going to probably talk mostly about gut microbiomes, but it's not just the gut. I mean, there's skin microbiomes, there's ear, oral microbiomes, microbiome in the mouth. I mean, there are microbiomes found on rocks. And so understanding this kind of complex diversity of bacteria and microbes and really creating and taking up this space is a big thing. And we're talking about a whole health aspect. You know, with regards to the gut, there's that old adage that always said, you are what you eat. And, that was one of the things that everybody was like, yeah, we understand. But now, with the technology and the science that we have, we actually can say and truly show you are what you eat because these foodstuffs that are coming down into the gut, they have to be processed, they have to be digested, and those metabolomes and everything else, proteins, short chain fatty acids, they all have to be going somewhere to be able to make the body function properly. And that's really what the microbiome is about, creating a sort of eustasis or a homeostasis, a balance in that gut in order to provide proper digestion and absorption for your body.
Right. And as Brandon alluded to, we have biome everywhere. The most important thing reason why we're focusing on the gastrointestinal system right now, but we could mention some of these other places too, because I know we're moving towards that, is that 70% of our immune system is in our bowel. So when we talk about dis-ease, things that are not happening correctly in the body, we have to really look at what is the situation in that GI tract, and also what kind of inflammation are we creating. People know the terms leaky gut syndrome, inflammatory bowel disease. These are all conditions that we can now look at with the biome and really get an answer, but not just to get an answer, but do something about. I am so excited because we used to guess. We were guessing on what food would actually help that situation, what supplement would really help that situation. And I have to tell you, I think I told you this, Brandon, but I went to Dr. Andy Weil's Integrative Summit a couple weeks ago here in Tucson. 1,500 DOs, MDs, nurse practitioners, naturopathic doctors, and one veterinarian, and that was me. And what was really exciting about it, and I'm not bragging about that, but what was really exciting about it is I approached the head of pediatric gastroenterology at Stanford University. This lady is the top. And I
Right.
listened to her lecture, and while I was in there, I raised my hand at the end and I said, I didn't hear anything about microbiome. And she said, well, I'm embarrassed to tell you that we don't know what to do with it. We're still working in the microbiome lab. We're still not sure about how to treat it. They do specifically, Brandon mentioned FMT, which stands for fecal microbiome transfer. They do those directly for things like C. diff or C. perf in our bodies. But she actually alluded to the fact that we as veterinarians are way ahead of them in this technology right now because of what we're doing with AnimalBiome, the company itself. And that's a real feather in our cap. And generally, as you know, Brandon, veterinary medicine typically lags behind human medicine a lot because there's a lot more
Yeah.
research money in human medicine. So applause to you guys and to all of us that are now encompassing this. 2,500 vets is great. I want that to be 25,000 at some point. I mean, and I'm sure you do too,
Yeah.
but it's coming. So let's talk a little bit about the basis of the AnimalBiome test. So the basis is basically at this point a fecal test. Speak a little bit to that and the information that it yields. And I don't know if you want to delve into any of your slides that show any of the reports. I know we can talk about that with certain conditions too, but just speak on the test itself.
Yeah, absolutely. So as of now, we have a couple of different microbiome tests, and we're going to have more, certainly for our veterinary side. But we can talk specifically, I think, about the gut microbiome because that's the one that has the most information and where we're at as far as actionable insights. And in regards to the gut microbiome test, we utilize fecal testing. And the question is why fecal testing? Why is that a deal? Why would you do that? Well, from what we've seen in research, it really is the best representation of what microbes are in the gut. And that's because when the feces is actually there and it passes down those bowels, the GI tract, you have that mucosal membrane kind of sloughing off into the actual stool. And so you get a fairly decent representation from the top of the GI tract all the way down to the large colon. And so great, now we kind of have this wonderful kind of test to be able to see what's going on inside. And the next thing is, well, how do we know what microbes are in there? I just talked about, that there's, all these different type of microbes and they're all coming. The actual number is pretty outstanding. The research is showing that there's about 100 trillion microbes in the gut. 100
That's
trillion.
incredible.
So
Yeah.
it's nearly, research varies on how many cells make up a human, but realistically, the number average is around 37 trillion. So it would take 3 humans, give or take, all of their cells, every single organ, all of those would amass into 3 of those people would amass into how many microbes are in one companion animal gut. And so think about all that genetic material that's being created on a minute by minute basis. And not only that, but how do you look at that many bacteria? How do you know what that is? And that really comes into the testing aspect. And so, let me share this with you. Let me share
Sure.
my screen real quick and jump into that because I think it's kind of important to kind of get into the different types of testing so we can kind of understand where we're at on a technological basis for companion animal, which is pretty great.
That would be great.
So here we kind of have this diagnostic testing model, and I kind of split these up. These aren't all the tests that we kind of utilize, but at the veterinary practice, this is pretty common for these type of tests, these two. So immunoassays, these are kind of going to be your SNAP tests. We'll get into a little bit deeper into this later. I just kind of want to show you. PCR looks a lot more complex, but realistically, it's growing genetic material, sequencing it, looking at things. Next-gen sequencing looks at the entire thing. Now, without delving into all this and boring all of your people,
Right.
I could kind of
Right.
give you a little bit of an analogy and really kind of jump into this. So I want you to think for a second of like kind of a mystery smoothie, right? And you need to find out what's inside. And so if we're utilizing immunoassay testing, right, this is a really quick, easy way to find out a specific ingredient, but you have to know if it's there or not. And the thing is that it won't tell you how many. So if I'm looking for strawberries, it won't say there's 52 strawberries in this batch of smoothies. Instead, it'll say, yes, there are strawberries, or no, there aren't strawberries. And so that's really the immunoassay kind of end. So you have to kind of know what you're looking for. With PCR testing, Think about that as like a super sensitive taste test. So this test, you could realistically, you could put it in your mouth and it would have the sophistication to be like, okay, that's a blueberry, that's a strawberry, that's a raspberry, and it'd be able to kind of pick out those. But once again, it is accurate, but you have to know what you're looking for. So if you don't have pineapple in your taste reference, then you won't be able to pick up pineapple. So that's great for those sorts of tests, but if we need to find out what's inside and get a whole health picture of that gut, we have to be able to utilize what's called next gen sequencing. And think of next gen sequencing as like a recipe book. It has everything. It completely decodes the entire smoothie, constructs it, deconstructs it, and will give you piece by piece. And not only that, but it'll tell you exactly how many strawberries, how many blueberries, pineapples, mangoes, kiwis, whatever's in there, it will tell you. And so this gives you a complete picture and understanding of what's really going on in that gut. If we're talking about smoothies and we're talking about putting it back onto dogs and cats, think about the blueberries as and strawberries as pathogens, right? Or bacteria, and kind of the smoothie is that intestinal tract. And so moving forward, what Animal Biome really has been able to do is we've created these fecal microbiome tests that allows us to have this large amount of data, understanding we can look at 5,000 different types of bacteria, be able to put them in a relative understanding of how much is in that gut. So yes, the patient might have E. coli, but if it's taken up 10% or if it's taken up 90%, there's a big difference there. And so that's really kind of what it does and how it shows you this kind of whole health picture. And so you can utilize this stuff for certain things like vomiting, diarrhea, but also inflammation, heart disease, stress, anxiety. I mean, there is direct correlation to all of this with regards to just looking at the gut. So once again, going back to that old adage, you are what you eat, we're definitely finding that out true, not just in research, but also clinically.
And what I want to tell our listeners is when Animal Biome does this next gen sequencing, we get a very detailed report back, and we'll talk about this a little bit more, but it really tells us what good bacteria we're missing, what imbalance we've got going on. Are there harmful bacteria in there and to what level? And all of this allows myself, the practitioner, to act on these things to really help our animals. So one of the questions I get a lot from my clients and from people when I've talked about this on podcasts and whatnot is, so what diseases are we talking about? And when I talk about this, I talk about dis-ease, D-I-S apostrophe E-A-S-E, because I'm looking also in Chinese medicine at conditions, the whole animal, not just an individual situation. But I will tell you, this is where people get blown away. And I think I just finished this podcast with the Love Dog guys. We were talking about behavior. We see animals that come in, mostly the veterinary visits recently, a lot of them to me are in a couple different areas. One is gastrointestinal disease, which we're discussing, vomiting, diarrhea, malabsorption, that type of stuff. Also, allergy, severe allergy. I am dealing with this with our animal biome research, and we'll talk about that. Also, cancer. In cancer, there's always a disruption of this biome situation, and we can help our animals. Remember, if we've got 70% of the immune system in the gut, we want that gut as healthy as possible to fight the cancer. The body has a great ability to help with dis-ease if we give it the tools. But the other thing is things like behavior. There's a huge gut-brain connection. It's being shown in papers in human medicine all the time. The trillions of bacteria that Brandon alluded to affect ganglion or nerve cells in the bowel, which goes specifically to the vagus nerve, also to the brain. And this is a huge situation. So one of the things that came out of this Love Dog podcast, because one of the guys is a nationally known dog trainer, is I wish veterinarians like you, Dr. Randy, would basically look at these things so that we could correct the biome to help with the behavior problems. If you've got inflammatory bowel disease, you've got colitis, you've got even just the imbalances, you're not feeling real well a lot of times, and that can make you really cranky. And think about our dogs. They can't tell us, many times we are looking at where's the pain coming from, but this could be the beginning. So I want people to understand that this has very wide scale implications on what we can do in veterinary medicine and what we have been doing. And if I'm not mistaken, Brandon, I think you've run at least 100,000 tests through AI with this at this point, or is it more than that now?
No, it's about that. It's about that in
Okay,
total. In our subsets and everything like that for healthy reference sets, so understanding what that core bacteria looks like, and happy to share a test. I have one pulled up as well to kind of at least give some insight to kind of show you from my practice. If
sure.
that's something you want to go over, we can definitely
Yeah,
kind of share
let's
too.
get to it. That's perfect. Yeah, I think people can
Okay,
see
great.
what we're talking about. That would be fabulous.
Yeah, let me see. Hopefully I'm sharing the right one. I think
Sure.
I am. Yeah. So um, this is kind of how the test looks after you get everything all said and done. It will go over kind of what the bacteria is missing, that there's some. It will say whether or not there's harmful bacteria. So this is kind of your report summary. And this is for, let me see if I can share the other one. This is going to be a skin case. I wanted to kind of share the
Right.
GI one, but the skin case is pretty interesting on these ones. What ends up happening is that they actually have a very diverse collection of microbes, but they're not in our healthy reference ranges. So
Right.
really kind of interesting how this works. But with this sort of thing, so we see here, over here on the side, we kind of have these markers and we kind of have our healthy reference ranges here. And there, you'll probably see these tests and they're going to be like, what is all this stuff? You can actually
Right.
open these up,
Right.
every single one of these, and read every single one.
Sure.
But know that we're kind of always there to kind of give hands. So we actually you can schedule a call with one of our animal care specialists and they can go over all of that. But regardless, so we're looking at this, you can see we have 53% of that total gut bacteria taken up by Blauchilla. And oddly enough, they produce anti-inflammatory compounds. Well, we have an
Yeah.
itchy skin case. And so the body's saying, something's wrong. We need to have these anti-inflammatory microbes in abundance so that we can decrease this inflammation. Now, that's what's occurring inside. And we can see that visibly here. If you have red, itchy, flaky skin, the gut is also working its butt off to try to get that inflammation down because it
No
starts
pun
there.
intended. Right.
Right, exactly. And so we come down here and we have some other microbes. Some are in pretty decent levels. We're missing some, but it's not completely empty. Um, and so one of these things like this that I see, E. coli is not very high either. It's in our normal reference ranges. No pathogenic bacteria. This is pretty indicative of a skin case where we have all the key players, so to speak, maybe in lower levels, but they're not at the correct abundances because there's things going on. And whether that's through diet manipulation, food trials, and being able to utilize the test to really get that bigger picture of how we can help with that specific patient. Not all dogs' guts or cats' guts are the same. And
Right.
so
Right.
understanding what they can and can't have is really, really important.
And
And so
I
that's
want to
really what it
stop
kind of
you.
goes
Yeah.
over it. Yeah,
Yeah. I want to stop you for 1 second because I want to tell people how useful this is to someone like myself. So I have what I see a lot of times are second and third opinions on dogs and cats that come to me who have been itching and scratching, licking their feet, having terrible ear infections, on for years. And they've been through what's called selective diets or diet restrictions or elimination trials. They've been on products called Apoquel and Atopica. They've been on steroids. They've been on antihistamines. And I always tell people that, we all know what the definition of insanity is, and that is, doing the same thing and expecting different results. So that's
that's
how these
right.
people end up in my office. And I will tell you that a number of years ago, I started using what's called Nutriscan testing through Dr. Jean Dodds, which is a food sensitivity test. And I coupled it
Yeah,
with my animal biome testing. Now I have one, what the dog is allergic to or sensitive to, not allergic to, but has food sensitivity to. And two, where are we in the scheme of things with this animal biome report? I've had dogs that have come in that have been so badly red and itchy and ulcerated and skin infections, and in 6 months look amazing. They go from pure white and red dog, the red being all the inflammation, to a pure white dog that's loving life and is on regular food. And we've basically just manipulated the biome, eliminated the foods that the dog was sensitive to, and it's a win. And I will tell you that this has revolutionized allergy in my world. And I'm so thrilled because, a lot of times in our world, we don't get to see results. Now, the thing that's hard about this is not a silver bullet. So you can't just give them a steroid shot and they stop itching and everybody's happy, knowing that the steroid is going to cause all kinds of other problems. We're doing this slowly, but like I said, that dog in 6 months looked amazing. And I've had this repeated numerous times. So it's an amazing situation, Brandon.
Well, that's really good to hear. And more and more research is coming out, thank goodness, in regards to that. And we've done a couple of studies with atopic dermatitis, and we've had pretty incredible results. It's not something that people think about. They don't think, well, fixing the gut is going to fix the skin.
Yeah.
But it really does an incredible job at that. My practice, we have my sister, she used to breed French bulldogs. And so
Yeah.
brachycephalic disaster with
Right,
GI and skin issues all
That's
day
good.
long.
Right.
Yeah. And
They're,
so,
they're,
I
they're
mean,
what
one
we
of the
call the
things that,
veterinarians. They call that the veterinarian's dream.
yeah, it's great unless they're your dogs, right?
Right.
Yeah, then it's just money.
Exactly.
But I think that certainly what we did, and I started really utilizing this and found that, these dogs are born via C-section. And one of the first instances of obtaining these microbes is through vaginal birth. And brachiocephalic dogs, they are born that way. They aren't born naturally. And so they don't get those native microbes in that initial instance. And you continually see those dogs having a lot of issues in the beginning stages and later on in life.
Yeah,
And so,
absolutely.
being able to put these native microbes in is really, really important.
Yeah, absolutely. Makes a lot of sense. Let's take a quick break. And Brandon, don't go anywhere, but I'm just going to take a quick break here and